Many women endure years of uncomfortable symptoms caused by menopause. Estrogen therapy might be a culprit. Here now with the facts regarding a common myth about hormone therapy is Dr. Lauren Streicher. Welcome, doctor.
Thank you, Elsa. Good to be here.
I'm happy to have you here because I feel like you can clear up a lot of myths. Let's start with hot flashes. I want to ask you how long they last and how they can be controlled or eliminated, because I know that that's something that a lot of women experience.
Absolutely. You know, first of all, up to 80%. When you say a lot of women, we mean a lot of women. Up to 80% of women will experience hot flashes. And on average, women are surprised to learn that they can last 7 to 12 years. And everyone has this idea that it's going to be short-lived, they can tough it out, they can do a healthy lifestyle, eat right, do yoga, and that's going to make hot flashes go away. And what we now know is that doesn't work. What does work is hormone therapy. Hormone therapy is the best way to reduce or eliminate hot flashes.
Okay, so with hormone therapy, does it have a higher dose of estrogen than birth control pills? Is it dangerous? What should we know about it?
Well, what you need to know is that birth control pills, which women take all the time and they're very comfortable with, actually have a much higher dose of estrogen than hormone therapy, because birth control pills need to suppress ovulation to prevent pregnancy. Hormone therapy, on the other hand, is a very relatively low dose of estrogen, which is used to alleviate symptoms. So in fact, if you do a blood test of a woman who's taking hormone therapy, what you will find is that her estrogen level is going to be much lower than a woman who's taking birth control pills, and even lower than a woman before she went through menopause.
It's really interesting. I'm wondering, some people say that when you are undergoing estrogen therapy, that can increase cholesterol. Is that true, or is that a myth?
It's actually a myth, and this is a big concern because a lot of women are told for the first time midlife that their cholesterol is up, their triglycerides are up, and the last thing they want to do is to take a medication that's going to make it even worse. And in fact, hormone therapy may decrease cholesterol in many cases. Now, oral estrogen, which is taken by mouth, can decrease cholesterol, but it might increase triglycerides.
Okay.
Transdermal estrogen therapy, which is administered through the skin and absorbed through the skin, not only might decrease cholesterol, but it can also decrease triglycerides. So this is huge.
Really interesting stuff. Absolutely. Okay, I also have to ask, because women want to know, does estrogen therapy cause weight gain? What about that?
That is the #1 thing that women want to know, and the answer is no. We know that many women do gain weight midlife, and there's a lot of reasons for that. But we have a lot of scientific studies that show that estrogen is not the culprit. And in fact, if a woman chooses to use hormone therapy, she's not going to gain weight because of it.
Another concern is vaginal dryness. I know that can sometimes accompany menopause. Is that something that can be alleviated through this therapy?
Absolutely. When we talk about 80% of women have hot flashes, well, 60% of women have vaginal dryness and thinning of the tissue that can be really uncomfortable. And there are a lot of remedies. #1, there are prescription hormone and non-hormonal options that will decrease the dryness. But women need to know that they can just go to their pharmacy and get an over-the-counter long-acting vaginal moisturizer that is going to increase lubrication. And it's really important that when someone is having intercourse, that they use a silicone lubricant, which is going to ease penetration and decrease pain. And for a lot of couples, this is a game changer.
All right, as we wrap up, I just want to ask you really quickly, what are the main risks associated with estrogen therapy? Because we talked about that at the open of this segment.
Well, absolutely. When the Women's Health Initiative came out in 2002, there was a lot of concern looking at things like, does it increase the risk of blood clots or heart disease or cancer? And what we now appreciate is that the differences between women who are taking estrogen or estrogen and progestin together, and we have to individualize this treatment, which is why it's so important for women to talk to their doctor or their healthcare provider to find out what their personal risks and benefits might be. But women can also get this information themselves, and there's 2 websites I'm going to direct women to.
Yes.
#1 is the WHI.org, where they can read that study themselves to look at the age of the women that were most affected, the types of estrogen that they were taking. And the other really good website is Menopausal.org, which is the North American Menopause Society website, where not only can you get good, accurate information about menopause and how to alleviate the symptoms, but you can also find an expert. Because even if you have a doctor or healthcare professional that you really trust, lost. They may not be an expert about menopause.
Dr. Streicher, we thank you so much. A lot of important information there. We'll be right back with more Midday Maryland right after this. Stay tuned.